For our partner project, we did how a speech-language pathologist and a nutritionist would work together.
So we started off by kind of explaining what a nutritionist is an expert in the field of food and nutrition and help others achieve their health goals. And then below that, you'll see some of the duties like advocating for nutrition labeling, teaching clients about food, developing dietary plans, basically things that have to do with food and nutrition.
And for a speech-language pathologist, you can see that they work to prevent, assess, diagnose, and treat speech-language, social communication, cognitive communication, and swallowing disorders in children and adults. You see what they evaluate and diagnose in speech, language, and communication. You can treat speech, language, communication, and swallowing disorders, how they provide training and education to family and caregivers and other professionals, and how they collaboratively work with professionals from many other disciplines.
And then for our situation, we came up with the situation. We made up a woman named Mary, and she's a 65-year-old woman. She suffered from a stroke, and because of that, she developed dysphagia, which is difficulty with swallowing. And issues that can arise from that would be dehydration, weight loss, pneumonia, choking. And we had this little tidbit that her favorite drink is grape juice, but because of her dysphagia, she stopped drinking it for fear that she might choke. And then we're going to go into how a speech-language pathologist and a nutritionist would work with this patient.
So for what an SLP would do, the SLP would first conduct an assessment of Mary's ability to swallow. By doing so, she would practice the barium swallowing test, and this is a special type of imaging test that uses barium and x-rays to create images for your upper gastrointestinal tract. Your upper GI tract includes the back of your mouth and throat and your esophagus. After seeing how the assessment would go for Mary on the x-ray, the SLP would provide a safe and effective treatment for her swallowing and documenting her progress. It's then very important to inform and educate Mary's caregivers and letting them know the different ways to help her in swallowing her foods and drinks in her everyday life.
And while the SLP would focus more on the physical ability of Mary's swallowing, the nutritionist would work more on the nutrition aspect of it. So first, they would conduct a nutrition assessment to determine how well nourished or malnourished Mary is due to her dysphagia. And then she would do an oral assessment to see what textures of food and fluids the patient would work better with. And then creating a nutrition plan to ensure the patient is receiving enough nutrients and hydration. And if Mary requires any medications, the nutritionist would prescribe those.
So next we will describe how they work together, and with the nutritionist's knowledge from the nutrition and oral assessments, the SLP's knowledge of how well the patient can swallow, they would then work together to determine what consistencies of food and fluids would work best for the patient, in this case Mary, so that they can receive the necessary nutrients while safely being able to eat and drink. Our example is because Mary loves grape juice, the nutritionist and SLP will be able to then determine that her grape juice needs a certain amount of thickening agent for her to swallow it safely. Over time, the SLP will teach the patient new swallowing techniques and therapy, and the SLP and nutritionist will work together to determine new consistencies for their food and fluids to later digest and swallow.
And our sources that we used for this, we gathered an article from the Journal of the Academy of Nutrition and Dietetics, which basically goes through exactly step-by-step how a nutritionist and a speech pathologist would work together in a situation dealing with a patient with dysphagia.
And that's all we have. Thank you.